Welcome back. Nearly 2 years after its initial release, health professionals are considering making the COVID-19 vaccine a yearly shot. In addition to adjusting the vaccination schedule to work as a yearly shot, the FDA is working towards allowing people to receive the shot in one dose. Joining me to discuss what this may look like is Professor of Epidemiology at the CUNY School of Public Health, Dr. Denis Nash. Doctor, thank you so much for joining me.
Thanks for having me.
Now, I want to talk a little bit just about the initial vaccine and the booster. For those who don't know, which I'm one of them, can you just explain the difference between the initial vaccine and the booster?
Well, for many vaccines, not just COVID, there's a process of getting multiple shots. The first one is the shot that helps your immune system recognize the pathogen for the first time, maybe, and that creates an immune response and antibodies that are then primed. Your immune system is then primed. So if you are exposed to the virus or the pathogen, it will mobilize quickly to prevent bad things from happening, including anything from infection to severe disease and death in the case of COVID. Um, Sometimes a single vaccine is not enough and not enough to create a lasting immune response. And so booster shots are needed. And so sometimes there may be, one or two booster shots after the initial primary series of vaccination, so that people's immune systems will recognize the pathogen for many years to come. And so that is what we have in the case of the COVID vaccine. The booster shots now, there's something slightly different with COVID, which is that they've also adapted these booster shots to recognize the most recent versions of variants of COVID that are circulating now, and the older vaccines did not. And so now what we have is a combination of the initial primary series plus booster shots that are recognizing the latest version of COVID that's circulating out here in the hopes of, providing an immune response that is as most protective as possible.
Now, I think it's really interesting that you mentioned that because, as I said previously, that a lot of people received their vaccine nearly 2 years ago now. And some people probably haven't gone back since or they never got a booster. Can you just talk a little bit? You said that, it's constantly being updated. So, what's going to happen for those people who, probably just got that initial vaccine? They were vaccinated, but they probably haven't gone back since.
Yeah, we have people in all kinds of different scenarios. There are people who were vaccinated a long time ago with the primary series and have never gotten a booster. Among those, you'll have people who were infected with COVID before they were initially vaccinated or infected with COVID after they were initially vaccinated. All of these people are in different situations in terms of where their immune system is and its ability to recognize the virus. But in general, because we don't really know the extent to which COVID infection mobilizes the immune system the way a vaccine does, and for the lasting immunity that that provides, it's important for those that had only a primary series of vaccine 2 years ago to get the most up-to-date shot. And that has the advantage of including the strain of the virus that has been circulating lately closest to Omicron.
Now, the FDA is proposing skipping over the initial vaccine shot, meaning patients will only have to take the booster. Why may this be appealing to the FDA?
I'm not sure why it would be appealing to the FDA. Of course, well, it's always helpful to be able to simplify the way we deliver vaccines to millions and millions of people every year, and so there's that appeal. But the FDA's primary job is to ensure both efficacy, that the vaccine is effective at what it's intended to do, and safety. And so it can't move to a schedule that is annual unless there's evidence behind it that suggests that it's safe and effective to do that. And so this is, I think, early days in what we'll see happening with the COVID vaccine. Right now, it's still recommended for people to get the primary series of vaccine followed by booster doses. maybe one day when COVID becomes a little bit more predictable and more seasonal, the way that influenza has become in this country, we'll begin to see moving towards an annual shot. But right now, most experts do not feel it's time to move in that direction.
I'm really glad that you brought that up because I'm one of the people that, I got my vaccine quite some time ago. So it's hard to think about what that process is like now. But you mentioned that it's still the same kind of like multiple steps. Can you just expand on that a little bit?
Right. So if you've never been vaccinated, you would start with the primary series of vaccines, which are the same ones that people got 2 years ago. They include what's called the wild type virus, the original COVID strain that was circulating back in 2020 and 2019. And then sometime after that, you are expected to get the booster shots. Um, but if you've gotten your vaccine 2 years ago, the primary series, what you would get now is the booster dose that includes the bivalent vaccine, and it combines the original wild type strain plus the Omicron strain. So it has both in there, and it's meant to improve. It's meant to improve protection against the current variants that are circulating now.
Now, in regards to just simplifying this overall process, which I know a lot of people eventually would like to, go towards, is this something that could, be beneficial to everyone, or will some people still need to kind of go through that series of different shots?
Well, that's a great question. And there are people whose immune systems aren't as responsive to vaccines and boosters. And these include elderly people or people who are immunocompromised. And I believe also, young children may need a kind of a series of vaccinations, kind of like we see them have for measles, mumps, and rubella, where they receive the initial series and then they get booster doses as they age. So these there are going to be some differences and different recommendations for different people, mainly aimed to help ensure that they're as protected as possible.
Now, vaccines were very controversial, and I think they still are very controversial. And I think a lot of people were hoping or assuming that, once they got that, initial series of the vaccine, that they wouldn't have to think about it again. Do you think it would be challenging to get people to kind of continue to get a yearly shot in regards to the COVID-19 vaccine?
Well, let me just first say that vaccines are not at all controversial among healthcare providers
Right.
and experts who have been, involved in studying these vaccines, developing them, and testing them. They're very clearly shown to be highly beneficial and protective against the bad outcomes that we're all trying to avoid. And there is no there's no question among us whether or not it makes sense for people to be up to date on their COVID-19 vaccines. So there's no controversy there in the community of healthcare providers and scientists and experts and epidemiologists like me.
Hmm.
Um, so then, is there still some hesitancy and concern in the community of people who may need to receive vaccines? Yes, and there are lots of reasons behind this, and a big one has been, related to people's understanding of what the vaccines are actually supposed to do. And there was messaging and an expectation, frankly, among scientists like myself that vaccines early COVID vaccines would protect people against infection as well as, and if they could prevent infection, of course, they would prevent people from dying or being hospitalized from COVID. But we quickly learned with variants that the virus could evade vaccines. It could still infect people, but the
Hmm.
vaccines still worked against protecting severe disease and death, and they still do so today. And so, but I think that resulted in a lot of confusion. Like, if I can still become infected with COVID after I'm vaccinated, why should I even bother getting vaccinated? Well, the reason is that you can still be protected against severe disease and death and many other things that are like often not talked about with COVID, like such as long haul COVID. It's increasingly being shown that vaccinations protect against this outcome as well. The other big reason why people are, I think, often question whether or not they should move forward and get additional vaccinations or get vaccinated for the first time relates to the unfortunate amount of misinformation and disinformation that is circulating on all levels of the media and social media and the internet, that I think makes people question whether or not there's a reason that they should avoid getting vaccination. And this is, it's very unfortunate. It's the result of a very deliberate effort to mislead people. The anti-vaccine community has been doing this for other vaccines for many years, and they've
Right.
really stepped it up for COVID. And it's unfortunate because it leaves people, unsure about what to do, or worse, completely misinformed about the benefits of vaccines.
Now, I want to add, I think you said it really well, and vaccines are important. So I'm glad that you kind of spoke on that. But let's say there are some people who are, maybe nervous about it, or it takes a little bit more encouraging. What could they do now to, just prevent themselves from getting sick from COVID? Would you still recommend, masks and other COVID preventions? Can you just talk a little bit more about that?
100%. If you're not vaccinated, or you're not up to date on your vaccines, or you're not ready to do so for whatever reason, there are lots of other things that you can do to protect yourself from COVID-19. To be sure, it's getting harder and harder because when some of these surges happen, they affect so many people, and even the most vulnerable people, even the most people who are trying the hardest to avoid COVID end up getting it during some of these surges. But masks still have always been very effective at preventing COVID infection. Also, avoiding large crowds and gatherings, especially where most of the people are unmasked. These are things that can help you, continue to avoid COVID. And even people who are vaccinated can use some of these strategies as well. It's important.
All right, doctor, thank you so much for joining me and talking about this. I think we definitely needed this update, for a lot of people who weren't staying up to date with COVID. So I really appreciate you taking the time to speak with us.
Thanks for having me.
To stay in touch with the CUNY School of Public Health, go to their website at www.cunyISPH.org. We've come to the end of our show today. I'd like to thank all of our guests for joining us and you, the viewers, for tuning in. If you missed any part of today's show, you can catch the recable cast at 5 and 10 p.m. on Optimum, Channel 67, and Verizon Fios, Channel 33, or watch anytime on the web at bronxnet.org. I'm Kibin Alleyne, wishing you and yours safety and wellness now and always. See you next time.